Good morning. It's good to see you on this beautiful Tuesday. How are you doing? Thank you so much for making time for us. As always, on Mind Doctor, my name is Winnie Lubem. But of course, today we want to discuss about diabetes. And as you all know, diabetes prevalence has been rising more rapidly in middle and low income countries. And of course, in 2016, an estimated 1.6 million deaths were directly caused by diabetes. And of course, another 2.2 million deaths were attributable to high blood glucose in 2012. So of course we want to look at some of these variables, why, and of course most of the time, the middle and low income countries being the most affected by some of these, diseases and conditions, of course diabetes being one of them. And lately we have seen an increase in the number of diabetes in children. Again, we also want to understand why. Is it the lifestyle that we are living right now, or what usually happens? So if you have any question in relation to the same, if you are diabetic watching us right now and probably have a question, clarification, or a comment, feel free to call us live. 0791-478990 is the number to call through, or alternatively send us a text message on 40920, and we'll be looking at your questions and comments a little bit later. But for now, my guest is here, so let's meet her. Good morning.
Good morning.
You look very colorful, brightening up the set. But thank you so much for coming by today, of course making time for us. And before we get into the discussion, kindly introduce yourself.
My name is Dr. Rispa Wambua. I'm a medical officer and licensed by the board, the Kenya Medical and Dentist Board. Currently, I'm not working. Yes.
All right. Yeah. It's going to come around. Don't worry. All right. But just talking about diabetes then, of course, this being, classified as a disorder of the metabolism. What does that mean? Just in a layman's terms so that we can all understand.
All right. What it essentially means is that, metabolism, it's all about how, like food we take, or the factors in the body, how they are digested, how they are worked on by the body to make it important or useful actually to the body. Yeah. So for that one, like for diabetes, the metabolism with the majorly it's the glucose. So glucose, like how we take food, it's not how it's how the cells take it. So it has to be broken down, and then finally you get glucose. Glucose is what you will get it into the cells. And insulin is also involved in metabolism of the lipids, the fat. In other words, the fat. So it's generally because it's about insulin and glucose and lipids. So it's generally a disorder of how those factors are broken down in the body. Exactly.
Is it then dependent on, because you see we have some people who have fast metabolic rate and we have others whose is a little bit slower. So does this also have, does it play a role in terms of, and especially for diabetics?
Everybody has a different way of metabolizing, but provided the speed really doesn't matter. Provided that it's able, if the body is able to metabolize, and then the remaining one is stored in the body. At the end of the day, it really doesn't matter the speed.
Because then it has something to do with weight and all those things. All right. Then out of curiosity, you see the way we say diabetes is a disorder, and someone was saying that it can, then that means if it's a disorder, it means it can be fixed. All right, and everything goes back to normal. But then again, we see a lot of people who are diabetics and they are on insulin for life, I would say. So then why is this so? If it's a disorder and it can be fixed, why do we still have cases? This is just out of topic a little bit, but just out of curiosity.
It also depends with the type. Especially if it's type 1, it may not really be fixed because the physiology, what brings it about, it's really different and it's beyond us. But for type 2, it's more of lifestyle. So you can actually work on it before it gets worse, before it gets to that state where you can really, you need to depend on drugs. But before that, then you have a role to play somewhere.
Makes sense. And of course also gestational, after pregnancy, most of the time it goes away. So type 1 is a little bit difficult
it's a bit difficult.
We'll discuss why. But then again, can we talk about then the pre-diabetes I don't know what either to call it phase or period, and then there are really, really big terms, yeah, that I have here: hypoglycemia and hyperglycemia. So what do this mean? But we can start with the pre-diabetes, I don't know, phase or stage.
So the pre-diabetic state, it's a state before diabetes.
Okay.
Like it's not you cannot say it's diabetes. It's not yet at that stage of diabetes. But it's also not normal. So
Okay.
it's a stage between the normal and the diabetic
Okay.
stage.
All right.
Yes.
So what's that normal and not normal?
Okay, so that one it's usually more in terms of the lab. The glucose levels in the blood. For the pre-diabetic, the blood glucose usually do the fasting. When fasting means you've not eaten, fasting, blood glucose, and you can do random. And also there's another one that you give glucose, and then after 2 hours you measure the glucose levels. Yeah. So for the fasting, if it's less than 7 millimoles per liter, and then it's the fasting or the fasting, the 2-hour glucose test is between 7.1 and 11.1. Now that's the pre-diabetic stage.
All right.
Yeah.
But what's the normal then? What's the normal range? And is it different for different people in terms of weight, age, and all those factors?
So the normal, it's usually for the fasting, it should be less than 7.
Less than 7.
7.1 actually. That's the ideal number. Though some labs usually have changes, very slight changes.
All right.
So less than 7 for the fasting, and then less than 7.1 actually for random, and then less than 6 for the fasting. So when it's more than that, now it depends. It can be pre-diabetic or diabetic. Okay. For diabetic now, the fasting is more than 7, and then the random and the 2-hour glucose level is more than 11.
Okay.
Yeah, 11.1.
Yeah, and for the, I don't know if you've answered this, for the children then, because like I said, we see a lot of cases for young children presenting with diabetes. So in terms of then the glucose levels at this period, what is the normal range for them, or it's the same?
The normal, okay, again, it also depends with the lab.
Okay.
Yeah, the labs usually adjust. So like every lab will give it will give its own like normal range for if it's for the children or for the adults.
Okay.
Yeah.
All right.
But mostly it's usually the adult is the one that you really focus more on.
Okay.
Yeah.
All right. And what about those then terms, hypoglycemia and hyperglycemia? What do they mean? Because they look really, really big terms. What are we looking at? Yeah.
So hypo just means lower than normal. So hypoglycemia is lower than the normal range, and then hyper means it's higher than the normal range.
Okay.
Yeah.
But then why don't we see a lot of cases of people with, let's say, lower levels? Most of the time it's usually higher, or sometimes it's not balanced. What could that mean? And if you have like lower levels of glucose in your body or in your system?
Okay, we usually see cases.
We do?
Yeah,
Okay.
but now, especially for the diabetics,
All right.
actually the most worrying state is the
lower,
hypo.
okay.
Yes,
All right.
the lower one, because that one can really, it's very dangerous. It will lead to death at the end of it all. It's very, we usually, it's even better to have the higher levels.
Oh yeah, because it can be managed.
Yes.
Okay, all right. We'll look at into them a little bit. But for now then, can we talk about how diabetes affect the body? But first of all, how does it even come about? I know there are aspects of genetics and especially for the children and even adults. So what brings about diabetes?
Okay, the opening statement is that really, like, it is really uncertain. Like, you cannot really point out.
Okay.
Yeah, but studies have been done, and there are factors that have been found. For example, genetic is really a big contributory factor, and especially for type 1.
All right.
Yes, for type 1, it's very, very important in that it plays a really big role.
Okay.
And then environmental factors, And then, okay, environmental factors, even the way we eat, the lifestyle, like sedentary lifestyle, those ones have a big role in it, especially type 2 now. Yeah, but for type 1, mostly, especially autoimmune, you see the genetic, it's also associated, type 1 is also associated, like when people have thyroid issues, like they have these conditions where the body is fighting against itself. Yeah. So you find that it also fights against the cells that produce insulin, and then it leads to it. Yeah, and then also now in pregnancy, that's also a predisposing factor because of the hormones, hormones that come about, but that one is temporary. Most of the time just goes away. Yes.
All right. But how different, even before we talk about the difference, in terms of type 1 and type 2, which one do we see a lot? Type 2, right?
Yes.
Type 2 is most common as compared to type 1. Okay, so then how different are they in terms of type 1 and type 2? Gestational, I mean, we know it happens during pregnancy, but of course, like you said, it goes away, on its own. So for type 1 and type 2, what brings about the difference? Is it in terms of severity, or what usually happens?
In type 1, there's usually insulin is not there, or it's very little.
Very little. Okay.
But in type 2, there is insulin, but the body is resistant to it. So that's the difference. So you'll find that now in type 1, there's no insulin. And for insulin, it's important in terms of taking the glucose into the cells, and then it's used to make, to produce energy, and then the rest is stored, and then and it's stored in the muscle and in the liver also. And then so when insulin is not there, also you find that the glucose is high, but there is no insulin. And then so the body will try to, because the cells are now deprived of glucose to make energy. So what they'll do, they now use the fat, and then now that one is the one that is used instead of glucose to make energy, because at the end of the day you need energy to do other things. To do other things. So you'll find that for type 1, now you find that they there's a lot of weight loss, rapid weight loss.
Okay. All right.
Yeah,
unintentional.
Unintentional. Okay. Unintentional weight loss and very rapid, because the body needs to get energy for these to run the processes. And then you find the other symptoms still the same as for type 2, like you drink a lot of water, urinating a lot. It's because now the glucose is a lot in the bloodstream, and then it's being released in the kidneys. So they are taking water, because glucose is very concentrated. So it's taking water from the body, and now you get dehydrated. So you need to take more water, and you're losing that water also in urine. So you find you're urinating a lot, you're drinking water a lot, but still...
It's still, Okay, but you see, I mean, talking about drinking water a lot and urinating a lot, people say, but that's normal. I mean, if you take a lot of water, you will end up visiting the bathroom more frequent as compared to those cases where you're not taking enough water, all right? So then, in terms of for diabetes, and of course, especially for being an early sign, how different in terms of, do you go like after every 5 minutes, 2 minutes, or what usually happens, so that people know? Because you see, if someone is taking a lot of water and going to the bathroom a lot of times, they will be like, this is normal.
Okay, so for diabetes, now you will notice a difference, because you realize there are some people who don't really take water, and others will take like 2 liters, the ideal they'll do, and they'll go to the washrooms, of course. So for diabetes, now when it's developing, now you realize there's a change in there's
regardless
a
of whether you take a lot of water or not.
You will realize if you've been taking water this much, now you're taking even more, and you're going to the toilet more.
All right.
Okay.
All right. And what about, very briefly, because we need to take a very short break now, in terms of the energy levels, are they like hyper, or what usually happens? Because you see, there's a lot of glucose as well.
In terms
For the
of
type 2,
energy,
yes.
Okay, for the glucose, it is there,
All
but
right.
it's not been
It's not being-
metabolized.
All right. Okay.
Yeah.
Okay. Makes sense. Okay. So let's take that short break. But of course, when we come back, then we'll talk about how it affects the body more, and how then do you know, especially for the early signs of diabetes. But remember, we're live, so that means you can ask your question anytime. From now, the number to call through is 0791478990, or alternatively, send us a text message on 40920. We'll be looking at your questions after this very short break. Stay with us. All right, welcome back. Glad you're still with us. This is My Doctor, and remember, today our focus is on diabetes. And of course, like we said, if you have any question in relation to the same, if you have a comment, if you want some clarification in regards to the same, please feel free to call us live. 0791478990 is the number to call through, or send us a text message on 40920. Like I said, we'll be looking at your questions a little bit later. But for now, we want to focus on then, because we said there's no specific course, like we can't really point and say this is what exactly causes diabetes, but then again there's some factors, risk factors that predisposes someone. So can we look at them very briefly before we talk about then how diabetes affects the body and of course a person in general?
All right. So we have these factors. As I said, hereditary, like genetic. For example, if you have a relative who has diabetes, it's also likely to especially a first degree relative. Yeah, and also in terms of environmental, even the things we take, like for example, even in that type 1, also we have things like chemicals, toxins, like I saw somewhere like this smoked food.
All right.
Yeah.
They're bad.
Yeah.
Aren't they like one of the safest? Oh wow. Okay.
Yeah,
All right.
it was interesting to me also. Like, oh really? Yeah. So you find that they are not toxic to the pancreas that produces their. And then we have things like obesity. That one is it's one because it causes now the body to have resistance to insulin, so it predisposes to type 2 diabetes.
All right.
Yeah, and also lack of activity also it also predisposes. Then as we said, also pregnancy. So those are some of the predisposing factors.
Okay. And of course, I was reading somewhere they were saying giving birth to a child who is a little bit on the higher side in terms of weight. So does that put the child at risk, or is it the mother who is at risk?
Both of them are at
risk. Okay. How so? Especially for the mother. Is it because, let's say, you eat a lot during pregnancy, or what usually happens? Because the baby is already big, and then, so how then does the mother become sort of like at risk of developing diabetes at this point?
Or you saying a risk of developing diabetes?
Yeah, and that is after giving birth to a baby who's slightly overweight.
Really, no, it's not related. But if the mother is diabetic, then there are risk factors, because for a big baby, of course, there are like trauma when giving birth, and then that's babies born to diabetic mothers, they get complications. But getting a baby is big. You're just eating a lot, but you're not diabetic. No, it's not. It's not really
directly a risk factor. But what about then an aspect of high blood pressure? I know we've talked about high blood pressure more often here on this show, but can we talk about then how this can predispose someone to getting diabetes, whatever type, either type, but mostly type 2?
Okay, so high blood pressure, it affects many systems in the body. So you find that actually diabetes and hypertension, high blood pressure, they are really closely associated. They work like they even, especially type 2. So it's like they also develop when as age increases. So there are also diseases of, I can say, age related. And then it affects hypertension affects the kidneys, and diabetes also affects the kidneys. And then for high blood pressure, really it's the relation is more when it's diabetes, like the diabetes will affect the kidneys. It will bring and you see kidneys also regulate the blood pressure. So when the kidneys are affected by diabetes, worsen the high blood pressure.
Okay.
And then high blood pressure, when it's uncontrolled, it worsens the effects on the kidneys.
All right.
So the effect now is like double.
All right.
Yeah, for
wow.
both of them.
Okay,
Yeah.
okay, okay, makes sense. And what about then the 40-year mark? First of all, why 40? Because we said, of course, age being one of them. But during my research, they were saying from 40, 45 thereabout, one is more at risk of getting diabetes. Why? Why the 40-year bracket?
I cannot really point out a specific reason why
Okay.
40. Yeah, but it's usually related to many things.
Yeah.
And like for example, fat. 40, like some diseases, you just hear 40, fat and all that. So the 40, I think it's about age, that it's advancing in age. And yeah, generally that, yeah, I can't really point out to the reason why 40.
All right.
Yes.
And then we have a question. Peter asks, if he takes tea, let's say once in a while, and I'm pretty sure this is a person who has a sweet tooth, so would take quite some amount of sugar in there. So they're asking the amount of sugar can then put him at risk of developing diabetes. And remember, this is once in a while. Yes.
Okay, for amount of sugar,
Yeah.
for a normal person, it really wouldn't affect.
Even if you take like 3 or 4 spoons in a, not in a day, but per cup.
But for him, it's not
Once
even.
in a
Yeah,
while.
it's
Yeah, it
once
doesn't
in
take
a
like-
while.
yeah, all
It
right.
doesn't take. So okay, for diabetes, the sugar you take, the food that you take orally, it's more. It affects more than the one maybe you can put through the veins or that.
Okay, all right,
Yeah.
okay.
So, but the risk is very high. Okay, unless you have the other risk factors. That
Okay.
one on its own cannot really
Yeah,
make
put
you
you at risk of-
diabetic.
yeah.
You need to now correlate with other factors. You need to
Okay.
have now the other factors in place, and
Okay.
then you add that one now. Now it brings
Oh,
you
yeah.
that. But
Because we have so many
it's-
people. I think you've also had this. I mean, growing up, parents will
Yeah.
tell you, "Wow, ukikula sukari mingi utakuwa diabetic." And so I think most of us have grown with that, notion that when you take a lot of sugar, you will get diabetes. But like he said, so many factors have to come to play for one to be diagnosed with diabetes. Okay, then
Exactly.
can you talk about a little bit about gestational diabetic? And do all women get this, or are there women who are more at risk of getting gestational diabetes rather as compared to others?
For gestational diabetes, it's actually related to pregnancy,
Yes.
specific. It's just specific, and it's first diagnosed in pregnancy.
pregnancy,
If
yeah.
somebody had diabetes before pregnancy, that's a different case.
All right.
Yeah.
But can it
so
worsen though if you had
it
a
does.
history of
It
diabetes?
does.
All right.
It
Okay.
does. Yes. So for gestational, okay, the reason why they get pregnant women get is because of the hormones,
All right.
hormones that are produced by the placenta when the baby is growing. So the placenta produces hormones that make the body resistant to insulin.
All right.
And
okay,
it's
before we answer that, we have a caller on the line. Sorry, we'll come back to that. But we have a caller on the line. Good morning.
Good morning. Hello.
Okay, good morning. We can't quite clear what the person is saying, so I don't know how we do this because, but of course, my producer will have to help us with this so that we get the question and then get back to. But you were talking about this aspect of gestational diabetes, yeah.
Yes. So all ladies, all women in pregnancy will produce those hormones, and then they will they'll affect the production of insulin, but it's not all women who get gestational diabetes.
All
Yeah.
right, okay.
So like you find that some are more at risk, and others may not even have the risk factors,
yes,
but
yeah.
it will just
It will
come.
just come, all
Yeah,
right.
it will come.
But then again, what about those women? You see, most of the time we have some women who have issues with their hormonal, I mean, they just struggle, their hormones are just all over the place almost all the time, the hormonal imbalance. So are they more at risk of then developing, or is it automatic that they will get gestational diabetes when they're pregnant?
Okay, it's not automatic
All right.
because for this one, it's something that it happens. It will happen to one person. It will not happen to another person. Yeah. So you'll find that yes, all of them will produce the hormones, and then but you will find one person is affected, the other person is not affected.
It's not affected. All right.
Yeah.
Okay. And then in terms of stage, at what stage does cases of gestational diabetes occur during pregnancy? Is it, let's say, during the first trimester, the second trimester, or the third trimester? At what stage is it mostly diagnosed at?
Okay, that's a general, like for these, for the gestational diabetes, okay, it's usually, it will be peaked. They go for the antenatal visits it's recommended the first trimester, but most women will not go from the first trimester. So you'll find that they'll go from the second and the third trimester. So that's when it will be peaked, so it may have started earlier.
Okay, yes. All right. So we have a question for you. The person who was calling, Malachi. 3 questions, I think, in one. So Vanessa will have to help me with this, my producer. So the first question is on insulin. They're saying, can you explain pretty well in terms of then the insulin and how, let's say, if it's not either produced or or the insulin gland. If it does not produce insulin, what happens? If it produces little, what usually happens? And then if the body is not able to process, what usually happens? So can we answer that before we take the next two?
All right. Okay, so when insulin, insulin, it's produced in the pancreas. Pancreas, there's the beta cells, they produce the insulin. So this insulin, its work is to ensure that the glucose is maintained in the body, in the circulation, and in the cells. So you find that when somebody takes food, now insulin is produced, and it initiates now the process of taking that glucose into the cells. Some of it is used. Then the remaining is now taken to the liver, to be stored, and then also to the muscles. So it's made in the liver, then taken and stored now in the body. And when now the glucose level is low, now the insulin levels now are low, then glucagon hormone is produced, and now it initiates now the process of getting insulin back. Yeah, so when it's not produced, insulin, like I was explaining in type 1, so you'll find that you need energy, but now this glucose, it's there, but you cannot use it.
All right.
Yeah, so what the body will do, it will look now for an alternative. And then now this alternative now goes to the lipids, the fats that is stored, and then it's now broken down and it produces energy.
All right.
Yeah, then for type 2, the insulin is there, but there's
the body
resistance.
is not able to sort of process it.
Yes.
Okay. All right.
And then now for this, it's associated with obesity.
All right. Okay.
Yeah.
Okay.
And then how it causes diabetes is because the obesity, this fat is also active, so it produces fatty acids, and these fatty acids now they compete with glucose, and they are competing for insulin.
All right.
Yeah. So at the end of the day, you find that the insulin now it's working on the lipids, and then the glucose is more resistant to this insulin. Yeah. So for type 2, you'll find that actually people are usually it's preserved. You'll not lose weight. You'll not. So that's basically it. I hope that
you've answered them.
Makes
okay.
sense.
All right. And then the second question. Remember when I asked you about the 40-year marker? Same person, that is Malik. Remember he had like 3 questions. So his second question is then why the 40-year mark? I think he's concerned, probably he's 40, a little bit concerned here and there about why specifically 40? Like once you turn 40, going to 45, you're more at risk of developing diabetes, either type 2, most likely type 2, because we said type 1 is more on the genetic side.
I think we'll need to go to search more about it.
But there's no like specific research, that just says why the 40-year-olds?
Yeah, I just know about the age, like you're now advancing to, you're transitioning now to like older age, and then the cells, they are less active, like the beta cells that are producing insulin, they are less active. And then you find also at that point, there are also other diseases. Now the high blood pressure comes in, and heart diseases also, they are playing around that time.
Okay.
Yeah.
All right. Third question. Again, still from the same person, Malachi. He's saying he pees a lot. He uses the bathroom a lot, and then went to a hospital, and he was told he has diabetes. So can you just explain more on that aspect of just frequent urination?
The frequent urination is because now you have glucose in the circulation. So this glucose is supposed to get to the cells, but it's not getting to the cells. So you have a lot of glucose in the circulation. And glucose, I don't know if I can explain from high school, the osmolarity and osmosis. Yeah, it was osmosis. So you find that when you put something and it's more concentrated, and the other one is hypotonic, or it's normal concentration, then it will pull. We used to do, I think, sugar and water. So you find that this sugar, it will pull that water into it. Yeah, so it's the same with this one, this sugar, which is highly concentrated. So it will pull water from the cells. And then you'll find that it's now it's pulling water into the circulation, and then the blood now goes to the kidneys. So you'll find that you're releasing a lot of water. Yeah, you're releasing a lot of water.
Does the color matter though? Because you see, there's some people who will just urinate frequently and not as frequent as this case of diabetes. But then does the color of the urine matter? Does should it tell you whether this is just normal frequent urination and this other one is more on the diabetic side?
The color may not matter. Okay, the urine will be concentrated, because of that high level of sugar in the urine. But the color may not really matter, because color of urine, sometimes it depends. Sometimes maybe you're taking drugs. Some drugs they are released in the urine. It will produce color. Also the food, sometimes some food that you eat. So it may really not reflect. It cannot be a specific, like one thing that will point out that this is diabetic urine.
All right.
Exactly.
All right. Okay. I hope Malachi has been answered all his 3 questions to his satisfaction. Okay. Back to then that aspect of gestational, diabetes, where we were asking, did we answer this in terms of those women who have like hormonal imbalance, just in general? Does this become worse, or does this automatically mean then they will have gestational diabetes?
For that one, for the hormones, there are those women who really have issues with their hormones, and but when it comes to pregnancy, every pregnancy is usually different. So it may predispose them, but it's not something that you can point out that yes, it's going to happen.
Definitely get it. Okay.
All right. Because some women, they are usually very okay, and if it's hormonal cycle, very perfect, but they
end up getting gestational diabetes. All right, so anybody can be affected. But what about those people who are carrying multiples, either twins, triplets, going forward? Are they more at risk of developing gestational diabetes?
Not really.
Okay.
Yeah, it's all about the hormones. Okay, they may be predisposed because now, like the placenta, it's more active, and if it's for the twins, to placenta, so you'll find that they may be predisposed, but it's not something that you can really point out
and say definitely. Okay. All right. So in terms of diagnosis, because we talked about a little bit about the symptoms, earlier on when we started the show. So then what usually happens during diagnosis, and can one do this at home in terms of just get the monitor and just do, check your blood glucose levels at home? Can you do it?
Okay, you may do it, but the ones that you use for diagnosis, it's better in the hospital setting, because we usually do 3 tests. You can do random blood sugar, you do fasting blood sugar, and also it's called OGTT, or 2-hour glucose plasma glucose
right.
levels. So for the fasting, glucose, now you have the normal, pre-diabetic and diabetic stage.
Okay.
For the normal, so for the fasting, less than 5.6 millimoles per liter. Some you may use the other units are mg per dl, but we rarely use those ones. We just use the millimoles per liter. So then for the random blood sugar, less than 7.8.
Right.
So that's normal. That's a very normal person.
Right.
Pre-diabetic, you'll get for the fasting 5. That 5.6 to around 7, and then for the random,
All right.
7.8 to around 11.1.
Okay.
Then for the diabetic, that's confirmed more than 7.8 for the fasting and more than 11.1.
All right.
Yeah, and then we also do we do also other tests. Now for the person who is already symptomatic, that's definite. And then for the one who doesn't have symptoms, now you have to confirm again,
All
like
right.
you repeat those tests again.
Okay.
Yeah,
And at what time do you do this, and especially for this test? Because remember, you know, like we said, I mean, most of the time, some people will just do it, and this is at home. When, let's say, they've taken a lot of, I don't know, like sugars and all those things, and will this give them, because like you said, it's important for you to go to a hospital for the diagnosis, but then in terms of just checking your blood sugar levels to just understand where you are at, what is like the best time to check? Is it in the morning or whatever time of the day? It's still fine.
Okay, it depends. Like for fasting, the ideal is 6 hours.
Okay.
It has to be at least 2 hours, but
All right.
6 hours. You've not eaten for the past
not
like
eaten for 6 hours. Okay, so morning would be ideal. 'Cause you're
morning
sleeping
will
during
be
the night.
ideal.
Okay.
Yeah. Then for random, you've eaten just any time. It doesn't really matter.
Okay.
Yeah. And then for that other 2-hour glucose, you're given glucose, 75 grams or 50 grams you take, and then it's measured after 2 hours. That's more diagnostic, and it's done in the hospital now.
Okay.
Yeah.
All right.
So.
Okay. So then let's say do all the tests, and then one is confirmed that they have diabetes. What usually happens? So they put on, depending on the type. All right. Can you talk about the treatment options that are there depending on what type of diabetes one has?
Okay, it depends on many factors because you need to know the severity. Then also in terms of dietary, okay, usually like advice on diet a lot, like adjust your diet, advice on exercise, and don't just sit. You need to exercise a lot and you lose weight. Try to lose weight, and then but if there are those symptoms, especially now, for like, because it affects every system of the body, but there are those systems that are affected,
More
like the
affected.
eyes, the kidneys, the heart. Yeah, so if we have those ones, then we need to really start that person on medication. And you see, for others, they actually, they just come in a serious crisis, like diabetic ketoacidosis. For type 1, they just come, they can even come in a coma.
Yeah.
And they've never known they are diabetic in the first place. So that person, even after treating the acute illness, you have to start them on drugs.
Yeah.
Yeah.
And especially for children, like you said, I mean, sometimes they will just, the parents will not know that, let's say, the child is diabetic and all that. So are there screenings for the same, and especially for children, just to ascertain whether they are diabetic or not, or whether they are at risk of developing diabetes or not? And even during pregnancy, is this also done?
Yeah, they're usually like the Well Child Clinic.
Yeah.
But that one, I know it's mostly for the under 5s. But it's good for parents to have these, there are families that usually have like family doctor. It just does, you know, a checkup for the whole family.
Yeah.
That would really be important to do the screenings. And then it's also important for the parents also to monitor how, like you can really tell this a particular pattern that your body is used to, and then you realize that it's changed. Yeah, like this person, this baby is taking, this child is taking a lot of water, you know, is going to the toilet so many times compared to the way I have known this child to be. So those are some of the things that will raise alarms, and you really need to, to go to your doctor and just have a checkup.
But what about the color of the eyes, the skin, nails, anything? Do you look at them as well?
Yeah, like they'll have like dry mouth.
All right.
Yeah, because of that dehydration that comes with diabetes. You'll find dry skin, dry mouth that has just developed, you know, though it develops over time, but you will really actually be able to recognize that. And then relating those symptoms, then you'll, and then the eyes, when it's affecting the eyes, they stop seeing well, you know, they're not seeing
Does
well.
it turn the color of the eye to a little bit yellowish?
I don't think it does.
But it affects the vision.
It affects the vision because the effect is inside the retina at the back of the eye. That's where it affects mostly.
Yeah. Okay. And then what about the diet? And this is just management of diabetes in general. What about the diet? Is it dependent then on the time? Because we see most of the time people will tell you, oh, I cannot take, let's say, certain foods. I cannot, it has to be, I don't know. I saw someone was using like the yellow maize flour as compared to the white one or the Wimby, you know, and all those things. So just take us through, you know, the aspect of diet in management of diabetes.
For the diet, they usually... It's usually, you're advised to take a balanced diet. That will be important for the body. But you avoid things like, you know, those fast foods. They have a lot of oil, a lot of fat. Yeah, and you see for this one, we are having issues with fat already. So you don't want to get there again to add more load to the body. So you're advised to take, and then to advise to take food low in fat. And also this salt. You don't add salt.
A lot of salt.
Because it will increase that osmolarity, and then it will worsen the situation compared to a normal person, which may not even affect them in the first place.
All right. What about sugar? Avoid sugar completely, or then is it dependent on the time?
I think it's usually dependent also on the severity. Sometimes it can be told very little or completely no. I think the nutritionists usually love to say no, just stop sugar totally. Because it will worsen this situation that is already getting bad.
So dependent on the time. Okay. All right. So then for the children, in terms of, you see they're still growing up, does this affect their growth pattern, especially those who are diagnosed with type 1 diabetes? Does it affect their growth pattern in one way or the other, or it's just normal?
For diabetes, for children, yes, it's mostly usually type 1. It does affect them, especially if it's not controlled. That's why we usually want them to, as soon as they are picked, we need them to be for it to be controlled. Because it will affect like their growth. For example, there I was explaining for type 1, you find that losing weight, and then you may have those tingling sensations on the feet, the hands. So it may affect their growth because it's affecting their system, it's affecting the kidney. It can affect the heart. Like it's a constellation of many things. They will not grow like the normal.
Like the normal children. Okay, so then what do you do to ensure that then they do not sort of remain there, but just grow much as it's affected, but just try to help them to keep up with children of the same age? Are there things that you can do? I don't know, improve, let's say put more nutrients in their foods, exercise, or anything else?
Okay, you just need to make sure the sugar is controlled.
Okay.
Yeah, because when it's controlled, then they have, because you see, if it's not controlled, for example, they're predisposed more to, for example, UTIs, and then also infection.
Yeah.
Okay, because
They're more
the
prone to
urine is
infections.
more concentrated, so you can get bacteria, then infection, and this infection will also now trigger the diabetes,
All right.
and then its complications. Yeah, so you just need to ensure that they are controlled. Actually, if they are well controlled, they will grow
All right.
well. They may not be affected
As
so
much.
much. Yeah.
Okay,
So
okay.
the gold standard is to control. Just make sure the sugar is controlled. Then you'll avoid these complications that will make them not to grow
Okay.
just well.
All right.
Yes.
And then this is what I read, and they're saying diabetes can dry out, one's skin, of course, making them more prone to injuries, infections, and of course they take longer to heal. So are there some of the skincare routines that, let's say, one can do to ensure that they prevent most of these cases?
Yeah, so the diabetes actually affects mostly the feet. There's even a classification for that, how it affects the feet, and it's because it affects the blood vessels of the extremities,
Right.
and also the nerves. So you find that somebody will walk, they'll be pricked by something, but they'll not even feel in the first place.
Okay.
So it will continue growing, it becomes a wound, and it's infected. So you find that you cannot, and they didn't even know, they didn't feel, because the nerves are affected, they don't feel pain.
All right. Okay.
Yeah.
Okay. Okay.
So taking care of the skin, make sure that it's clean, because cleanliness is number one. If
Yes.
it's pricked, you didn't even feel in the
Feel it,
first
you'll not
place,
get
and then
the
the
infections,
skin
yeah.
is dirty, definitely the bacteria will get in and it becomes an issue. So taking care of the hygiene part of it,
All right.
and also making sure that it's not dry. Just apply
skin is not-
oil,
okay,
yeah,
all right,
apply
okay.
oil and ensure that it's clean. For the nails, keep them short and clean, especially the feet. Really, the feet are usually
The feet are the
more
most
affected. Yeah,
okay.
most affected.
Okay. And what about then exercise? Because you see, then you don't want to do so much. Go to the extreme. So how much exercise is recommended, either for a child or an adult with diabetes?
For exercise, okay, do considerable exercise.
Exactly,
Don't
yeah.
overdo it. Yeah, like if it's okay, can give an example. Like in the morning, you can just do like jogging. Yeah, you just make sure at least you've exercised to the point that, see, you just walk, you just walk, and then you don't even feel like you've really done something.
yeah, okay,
Yeah, at least
okay.
you need to sweat a bit, and then then you can do in the evening.
Okay.
Just make sure that you are fit, because you do exercise. Don't just sit.
All right.
Yeah,
Don't lead a sedentary lifestyle. Okay. Then in terms
Exactly.
of prevention, I know for the genetics we can't really do much about it, but of course the other types, that is the type 2 mostly, because you see type gestational again happens during pregnancy, not all the time, so we can't really say this. But is there a way that one can do in terms of prevention for both type 2 and, let's say, gestational? Type 1 is a little bit tricky.
Yeah, type 1 is tricky. For type 2, they are just the common things, like watching your diet, and then just avoid these fast foods. Then that will get you to obesity and all that. Then exercise. Yeah, that's basically like what really happens. I actually read somewhere that coffee also
Can lead to
yeah,
Okay.
coffee is one of the toxins,
All right.
in quotes, that
Okay.
can affect beta cells
Wow.
of the pancreas. And
Okay,
then
the
it
way
will
there's some people who
dispose.
can take like so many cups of coffee in a day.
Even me, I
Yeah.
drink coffee.
All right.
Yeah, but that sounded really interesting.
Okay, all right.
Yeah.
So avoid some of these things. But what about those people who are already obese? And sometimes losing the weight might be difficult in terms of just shedding the entire, the whole weight at once. It takes a little bit of time. So what can they do in the meantime? As let's say you try to lose weight, is there anything else that one can do? Because of course this will predispose them to getting diabetes.
Diabetes. Okay, what they need to do mostly now is to do the exercise, because exercise will also help in terms of making the body more sensitive to insulin. As they work on reducing the weight, then maximize on the exercise.
Okay.
Yeah,
All
and
right.
then now the diet. So let the other things now be put in place as you wait for the weight
Okay.
to go down.
But what about if someone, for those who are dependent on insulin, what if they miss to take, their insulin, let's say in a day? What could happen? Just out of curiosity, what could happen if someone misses, forgets, or they run out of it and they have not replaced?
Actually, for the people that have missed, they are totally dependent on insulin and they've missed their doses, they usually relapse. It now complicates. Now you see for mostly it's type 1 that usually use insulin, they are dependent. So what happens, now this insulin you've not taken, so the body now breaks down the fat.
The fats.
And these fats, they produce ketones. Ketones now they come, and that's why it's called diabetic ketoacidosis. So you find now it affects the body, like it's a whole constellation of symptoms. Some even come in coma.
All right. And unfortunately, in the interest of time, we have to end the show right now. So Dr. Rispa, thank you so much for coming by today and for helping us understand on matters diabetes. And thank you so much for staying with us as well. I believe that for those of you who asked your questions, I believe that you have been answered to your satisfaction. My name is Winnie Lubembe. On behalf of everybody who put together this show, we wish you a lovely day ahead. We'll see you again tomorrow, same time, same place, for another episode of My Doctor. But for now, it's a goodbye from us. God bless.